Hello everyone, I'm very happy to share our work, CTFear, a fear emotion intensity classification method based on EEG and real-time labeling in virtual environment. The emotion recognition technology based on EEG has become an important research direction in the field of emotion computing due to its non-invasive advantages. Virtual reality, VR, is increasingly used in psychology and medicine as immersive and high-presence environments can enhance emotion induction. Fear is a key evolutionary survival mechanism, and objectively quantifying its intensity is practically important. In treating anxiety disorders, PTSD, and phobias, imprecise assessment of fear intensity can limit the effectiveness of regulation and intervention. Fear exposure therapy reduces phobia severity by repeatedly exposing patients to fear-inducing stimuli until habituation occurs. VR is widely used to deliver realistic, safe, and controllable fear scenarios, overcoming the limited realism of imaginal exposure and the risks and low controllability of in vivo exposure. To optimize VR-based therapy, therapists must assess fear intensity in real time. But traditional self-reports and behavioral observations are subjective and context-dependent. EEG-based neural decoding offers objective, millisecond resolution quantification of fear intensity, enabling dynamic adjustment of exposure levels. Therefore, combining EEG with VR can improve acrophobia exposure therapy, making accurate real-time fear assessment essential. Currently, existing fear intensity labeling methods can mainly be divided into the following 5 types. Most of these methods adopt passive video induction paradigms or post-event recall assessment paradigms. However, the labels in these datasets have issues such as low temporal resolution and poor timeliness. Based on such datasets, algorithms find it difficult to achieve high-accuracy real-time assessment. Therefore, we propose a dynamic fear intensity labeling method based on fear-conditioned reflex actions. During EEG data acquisition, participants press the controller trigger to record their current fear intensity in real time. Higher fear intensity corresponds to a deeper trigger press. Specifically, while watching immersive VR videos, participants continuously press the trigger on the VR controller, converting their subjective fear intensity into real-time continuous labels. To improve label accuracy, haptic vibration cues are provided at preset trigger depth thresholds. These haptic cues serve as physical anchor points, enabling participants to distinguish different fear levels without visual confirmation. Because fear intensity labels from different participants need to follow the same standard, we designed a fear intensity scale, as shown in the table, based on the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5. The table delineates 4 levels: no fear, mild fear, moderate fear, and extreme fear, and each level is paired with specific physiological responses and situational examples, allowing participants to quickly and accurately categorize their own emotions during labeling. Before the experiment, participants read this table to learn the grading criteria for fear intensity. To evaluate the effectiveness of the labeling method, this paper proposes a hierarchical feature fusion algorithm that combines CNN and transformer, namely CTFear. The goal is to apply different fusion strategies to features with different characteristics and dimensions, and then produce final predictions via a classifier. The overall architecture is shown in the figure. Specifically, data from consecutive time periods are fed in parallel into a spectrogram encoding module and a spatial encoding module to obtain feature sequences. These feature sequences are then further encoded by a temporal encoding module, and the final prediction is output by the classifier. We recruited 10 participants, 7 male, 3 female, aged 22-25, all with some degree of acrophobia to ensure effective fear induction. Acrophobia was chosen because it elicits stable, measurable physiological and EEG responses. VR can evoke high ecological validity reactions, and real-time fear quantification is clinically important for adaptive VR exposure therapy. The experimental procedure is shown in the figure. Each participant completed 10 trials. Each trial consisted of a preparation stage, a baseline stage, a playback stage, and a rest stage. In each trial, a previously unplayed video was randomly selected for playback. After the baseline stage, video playback and triggered data recording started simultaneously. After pre-processing, EEG features were extracted following the pipeline shown in the figure. To obtain training samples, we used a 9-second sliding window to segment each electrode's EEG signal with a step size of 1 data point, thereby increasing the number of samples in the dataset via a small step size. This process aims to fully utilize each short EEG segment collected in the experiment, capturing fine-grained details related to fear. To evaluate performance under different levels of classification, we designed 3 classification tasks and validated model performance using cross-trial and cross-subject cross-validation. Experimental results showed substantial cross-subject variability. Compared with cross-trial validation, cross-subject performance dropped and variance increased. This was mainly due to differences in scalp conditions, labeling consistency, individual EEG response patterns under the same fear level, and imbalanced training samples across subjects caused by differing acrophobia severity. The confusion matrix shows that each category is more likely to be classified into the adjacent category, indicating that the model has successfully learned the EEG features related to the intensity of fear. We visualized CLS token attention across electrodes in the spatial encoder. Attention was initially balanced, then concentrated on the left frontal, left posterior temporal, and right temporal regions, with secondary focus on the left temporal, right posterior temporal, occipital, and bilateral frontal areas. Ablation results indicate that each module and improvement contributes to performance gains. As task complexity increases, removing components leads to larger performance drops, highlighting the importance of multi-module collaboration for feature extraction and information fusion in complex tasks. The duration ablation results show that a 9-second window was a good trade-off, avoiding excessive computational cost while maintaining high classification accuracy. The figure presents box plots of F1 scores for 5 algorithms across 3 tasks, showing that our method consistently outperforms the baseline. We further compared end-to-end performance across labeling strategies, input data types, and algorithms. Compared with prior work, our approach combines finer-grained labeling with richer time-frequency representations and a deep model for complex tasks, substantially improving fear classification accuracy. Confusion matrices for models trained on datasets labeled by each method are shown in the figure. Compared with the 5 baseline labeling methods, our approach achieves consistently better overall performance. This paper introduces a trigger-based real-time emotion intensity labeling paradigm that reduces recall bias and enables real-time intervention. It also proposes the CTFear model, which achieves superior performance across multiple emotion intensity classification tasks. Together, they support real-time fear decoding for mental health assessment and neural feedback-driven interventions such as adaptive RED, where exposure intensity can be dynamically adjusted.